Good afternoon, everyone. So, you guys are able to hear me?
Good afternoon, ma'am. Yeah, yes, ma'am.
So, can you just help me to recognize कि हमने last session में क्या पढ़ा था? I think we have studied till the chapter number 19, right? Not 19, chapter number 2nd. We have completed the chapter number 2nd as well as the chapter number 3rd, is it?
Yes,
So,
ma'am.
we have to I think we have covered the chapter number 5th also. We have already gone through with the guideline for F45 or 41, is it? Or we have to start the chapter number 5th? Did we completed the chapter number 5th or we have to start this? I think we have completed this chapter. So we have to start the chapter number 6. Nomenclature, neoplasm builder chapter. And now we have to start the chapter number 7. So does anyone have any question till the guideline chapter number 6? Or would you like me to repeat any specific guideline? So I remember that we have already covered the guideline for dominant and non-dominant as well as the pain guideline when we have to use the G89 code and when we do not. We did few questions also like chronic right knee pain or something. So we have already covered the guideline number 6 or chapter number 6. So does anyone have any question till the chapter number 6 or we are good to start from the chapter number 7? We just have few candidates. Arun, did you have any questions so far? Gauri, Jamil, Lokesh, Shilpa.
No, ma'am.
Perfect. So let's start with the chapter number 7. In the chapter number 7, we have the codes for the diseases of eye and the adnexa. Any conditions or any problems for eye as well as any organ which is situated next to the eye or related to the eye such as retina, cornea, optic nerves. In that case, we have to use a code from series H00 to H59. So H00 to H59 codes represents diseases of the eye and the adnexa. So first, in this chapter, we have the guidelines only for glaucoma. We have the guidelines only for the glaucoma. Our glaucoma codes varies based on the type of glaucoma as well as laterality. So I'm going to pull the code. It's H. So let's try at the 700 page number. So our glaucoma code starts from series H40. All of these codes requires the 7th character. As well as these codes are based on the type of the glaucoma, whether it's in primary open angle glaucoma, low tension glaucoma, chronic angle closure glaucoma. So the type of glaucoma as well as laterality of the glaucoma, whether it's in right eye or is it in left eye. We do have the codes for the bilateral eye. We have to use the bilateral code only if the type of glaucoma as well as type of glaucoma as well as stage of glaucoma is same in both the eyes, then only you have to pick a code for the glaucoma. So glaucoma codes we have to pick only if the type of the glaucoma as well as stage of the glaucoma is same in both eyes. If we have a different type of glaucoma in both eyes, we have to use two separate codes. If we have a different stage of the glaucomas, let's say patient have the same chronic angle closure glaucoma, moderate stage in the left eye and the mild stage in the right eye. In that case, we have to use two different codes to represent the two different stages. So bilateral code needs to be used only if the type of glaucoma and the stage of the glaucoma is same in both the eyes. If type varies, then also we have to use two code for one for each eye for the different types. If the stage varies, then also we have to use two different code for each eye. Does that make sense? Does anyone have any questions so far? Mhm.
No,
Okay,
ma'am, I didn't get, ma'am.
okay. I'm going to repeat it one more time. So let me know one thing. You guys are comfortable in the Hindi or we should continue with in English? You guys are okay in English? Okay, perfect. So I'm going to repeat it one more time. Our glaucoma codes varies based on the type and the stage of glaucoma. You can see we have a different code. This one pigmentary glaucoma, this one chronic angle closure glaucoma. Earlier we have a open angle. Here we have a intermittent angle closure glaucoma. So we have a different type of glaucomas here. Code for a different type of glaucoma. As well as each code requires the seventh character. You can see here each codes require the seventh character. So the seventh character will represent the stage of glaucoma, whether it's in mild stage, moderate stage, or the severe stage. And if the stage is not documented, we have to use seventh character 0. And if it is indeterminate stage, we have to use seventh character 4. Indeterminate, we need to use only if doctor mentioned that I'm unable to identify the stage of the glaucoma. Then only we have to use the indeterminate stage. So our codes varies based on the type as well as stage of the glaucoma. We do have the option for the bilateral eye, glaucoma for bilateral eye. We can use a code for the bilateral eye only if patient have the same type of glaucoma in both the eyes and the same stage of glaucoma in both the eyes. Then only we can take bilateral, else we have to code each side separately. Is it clear now? If not, we have to do the question now then. I'm going to send one question. So we will try to solve that question, then we will reread this, okay? So try to solve the question number 3. solve the question number 3. You already have the books. Try to find the code for the question number 3. I have just received the answer from the one person. Still waiting. Oh, thanks, Jamil, for sending the response. Rest. Jamil, you need to complete the code, the first code, as well as the second code. Mashitha, you need to complete the code as well. These codes require the seventh character, so you need to append the seventh character also. Right side mile and left side mod. Right side mile and the left side mod. So now we are going to solve this question together. Okay, Jamil, you have completed this question incorrectly, so we are going to do it together. So patient have the glaucoma, chronic ankylosing glaucoma. So what we will do, we will refer glaucoma in the index. Then one of you can tell me the page number of the glaucoma. It should be at 250 or 240. Let's try 240. So glaucoma, let's scroll it up. Here we go. Glaucoma. So under the glaucoma, patient have the chronic ankylosing glaucoma. So we can see here where we have the angle closer. So that we have the chronic. So answer should be H40.22. But now, as we have the tick mark after the H40.22, that means this is an incomplete code. We have to complete this. So what we are going to do now, we are going to fill the code in the tablet. So 695. So we have to pull H40.2. Here we go, H40.22. So H40.22. Now these codes needs the 7 character. We can see here 7 character. And we know that 7th character is always listed at the beginning of series. We can find the 7th character at the beginning of the series only. So what we have to do, we have to go to the H40.2 to find out the 7th character. So we can see in the right eye, patient had the mild stage, and in the left eye, we have the moderate stage. As we have a two different 7th character, we have to, for the mild stage, we have to use 1 as in 7th character, and for the moderate, we have to use 2 as in moderate 7th character. So as we have a two different 7th character to represent the stage of the glaucoma, we have to use two codes. So we have to use separate code for the right eye so that we can use the 7th character 1 to represent the patient have the mild stage in the right eye. As well as we have to use H40.222 to represent the patient have the moderate stage in the left eye. So what we have to do, we have to use two codes here, H40.2211, H40.2211 to represent its mild stage. And for the left eye, as in the left eye patient have the moderate stage, our 7th character should be 2. So first 6 character here, 7th character 2, our code should be H40.4 times 2. So Jamil, we cannot use 7th character A in all the situations. To see the 7th character, what we have to do, we have to refer the beginning of the category to identify what all 7 characters we have this for category, for the same category. And we have to pick the code based on the category mentioned or the 7th character mentioned at the category level. Clear as Jamil? Jamil, is it clear to you?
Yes, ma'am.
Okay. Now what you have to do, you have to go through with the guideline number 1, 2, 3. Remember one thing, we have to use bilateral code only if we have a same type and the same stage. If we have a different type and the different stage, we have to use the two different codes. And all glaucoma codes are from series H40, which will represent the type of the glaucoma, and the 7th character will represent the stage of the glaucoma. Let's move further. Now, let's say patient is admitted with the glaucoma of a particular stage. Let's say patient came with the stage 2, moderate stage, and during the hospitalization, it has been turned out to be severe stage. It has been evolved, not resolved, evolved. So it has been increased. So if during the hospitalization glaucoma stage increased, in that case, what we have to do, we have to use the highest stage only. We are not going to quote the lowest stage. So in this case, we have to quote the highest stage of glaucoma. We are not going to quote the lowest stage. And we just need to use one code to represent the highest one. Next, we have the indeterminate stage glaucoma. The 7th character 4. Let me show you one more time. 695. We can see here we have a 7th character option here. So 7th character 0 will represent unspecified stage, 1 will represent mild, 2 moderate, 3 severe, and 4th will represent the indeterminate stage. We have to use the indeterminate code only if the doctor mentioned that the doctor is unable to determine the stage of the glaucoma. then only we have to use the seventh character 4. If the stage of the glaucoma is not documented, in that case we have to use seventh character 0. So if the stage of glaucoma is not documented, in that case you have to use the seventh character 0. If the doctor clearly tells you that he is unable or he or she is unable to determine the stage of glaucoma, in that case you have to use the seventh character 4. Clear? Any questions in the guideline number 5? Okay, so no questions. So let's move further to the next one, blindness. For blindness, our code varies based on the categories. Just give me a second, let me pull the code. So here we have the series for the blindness, H54. So our H54 codes based on the category of blindness, as well as laterality, if the blindness is on one eye or the both eyes. So if the category of the blindness is not mentioned, but we have the documentation that patient have the blindness in both the eyes, so in that case we are going to use the code H54.3. So we have to use H54.3 whenever patient have the blindness in both the eyes, but category of the blindness is not documented. Category 1, 2, 3, 4, nothing is documented. So in that case, we have to use H54.3. If the patient have the blindness in the one eye and the category is not mentioned, in that case, we are going to use H54.6. So we have to use H54.6 if patient have the visual loss or the blindness in the one eye. In that case, we are going to use H54.6. If the patient have the blindness and it is not category is not mentioned, as well as eyes bilateral right left is not mentioned, in that case we have to use H54.7. So H54.3 will represent patient have the blindness both eyes. H54.6 will represent that patient have the blindness in one eye, and H54.7 will represent that patient have the blindness only. It will not represent whether patient have the blindness in the one eye or in the both eyes. In that case, we are going to use H54.7. Any questions so far? Just take a moment and go through with the guideline number B. I'm going to mute myself for a moment. Done with the reading? Any questions in the guideline number B? Okay, I'm moving further. Chapter number 8. It does not have any guideline in the chapter number 8. Chapter number 8 quotes H60 to H95 will represent the conditions of the ear and mastoid process. So any conditions for the ear and the middle ear, we have to code it through the code H60 to H95. Next, we have chapter number 9, diseases of circulatory system. So in this chapter, we have the guidelines for the hypertension, acute myocardial infarction, and cerebrovascular accident. So the chapter number 9, code from series I, will represent all the circulatory system diseases. But the guidelines we have, the exceptions we have is for the hypertension, HMI, AMI, as well as CVA. So let's get started with the hypertension first. So hypertension. Our hypertension codes varies from I10 series to I15. I'm going to pull that code in the tableau for your reference. Just a second. Here we go. So we have a code from series I10 to I15. So our first code is I10. We have to use a code I10 whenever patient have the hypertension only. So if the patient have the hypertension, a specific hypertension only, there is no other further conditions, then we are going to use a code from series I10. So I'm going to mention it here too. So if the patient have the hypertension only, we are going to code I10. Now, based on the ICD guideline, whenever patient have the hypertension, chronic kidney disease, and heart failure, in that case, you have to presume the relationship between these three. So what you have to do, you have to presume the relationship between these three conditions, that is hypertension, CKD, and the heart failure. You have to presume that until unless doctor will clearly states that patient have the hypertension or the other condition, whether CKD or the heart failure is due to the any other condition. Then only you have to use a separate code for each condition. If the relationship is not documented with a hypertension or with any other condition, in that case you are going to use a combination code. So what combination codes we have available here? So first we have I11. I11 is for the hypertensive heart disease. So whenever patient have the hypertension as well as the heart disease, in that case you are going to use a code from series I11. So I11 code is further divided into the two parts, I11.0 as well as I11.9. I11.0 will represent heart disease with the heart failure. So I11.0 will represent hypertensive heart disease with the heart failure. If the patient have the heart failure, in that case, you have to use a separate code for the heart failure in conjunction with the I11. Why we need the separate code if the heart failure is already included? Because we have to identify, we have to specify the type of the heart failure. To represent the type of the heart failure, we have to use an additional code from series I50 in conjunction with the I11.0. Next, we have I11.9, that is hypertensive heart disease without heart failure. So, if the patient has the hypertensive heart disease without heart failure, in this case, you have to use a code from series I11.9 only. If the patient has the hypertensive heart disease without heart failure, in this case, you are going to use a code from series I11.9. And here you don't need to use a separate code from series I50 because your patient does not have the heart failure. So if the patient does not have the heart failure, we are not going to use a code from series I50 to represent the type of the heart failure. So I'm going to start from the beginning. So let's say if the patient has the hypertension, we have to use a code from series I10. If the patient have the hypertension as well as the heart failure, then we have to use a code from series I11. So let's say patient have the hypertension and heart failure. In this case, what you have to do? You have to use a code from I11 followed by a code from I50 to represent the type of heart failure. Represent the type of heart failure. So our second code is I11. Next situation is whenever patient have the hypertension and the CKD. So we are going to mention it here. So if the patient have the hypertension and the CKD, in that case we are going to use a code from series I12. So we have to use a code from I12 whenever patient have hypertensive chronic kidney disease. In this case, we have two codes. First, we have I12.0. I12.0 needs to be used whenever patient have the hypertensive chronic kidney disease for the stage 5 as well as stage 6. So whenever patient have the hypertensive chronic kidney disease for the stage 5 and the stage 6, in this case, we are going to use I12.0. With I12.0, we have to use a separate code from series N18 to N18.5 and N18.6 to represent the stage of the chronic kidney disease, whether it's a stage 5 or the stage 6. So to represent the stage of the chronic kidney disease, we have to use a separate code in conjunction with the I12.0. So here the question arises, if we are already showing that patient have the stage 5 CKD or the stage 6 CKD with the help of I12.0, then what is the need of the N codes? So we have to append the N code to represent whether it's a stage 5 or whether it's in stage 6. Next code we have from this series is I12.9. We have to use I12.9 whenever patient have the hypertension and CKD and CKD stage 1 to 5. So if the patient had the CKD stage 1 through 5, in that case, we are going to use a code from series I12.9. Even in this case also, you have to use a separate code to represent the stage of the chronic kidney disease, whether it's in first stage, second stage, or the unspecified stage. So to represent the stage, you are going to use a separate code from N18 to represent the stage of the CKD. So whenever patient have the hypertension and CKD, what you have to do, you have to code the I12 first followed by a code from series N18 to represent the type of chronic kidney disease. So to represent that type of chronic kidney disease, you have to use a separate code in conjunction with the hypertension. Next we have I30. We have to use a code from series I13 whenever patient is coming for the hypertensive heart and chronic kidney disease. So whenever patient have the hypertensive chronic kidney disease, in that case what we have to do, we have to code the from series I13. So whenever patient have the hypertension, CKD and the heart failure, whenever patient have all three conditions, in this case we have to code I13 first, followed by a code from series N18, then a code from series I50. So N18 will represent the type of CKD and I50 will represent the type of heart failure. So whenever patient have the hypertension, heart failure and CKD, all three conditions. So in this case, we are going to use a code from series I13 based on the type of the heart failure and the type of the CKD. And then we have to use a separate code in conjunction with the I13 to represent the type of the heart failure as well as to represent the stage of the CKD. Any doubts so far? Any doubts, any questions? Okay. Moving further, we have to use combination code only if we does not have the documentation of relationship or only if it was mentioned that patient have the hypertension or CKD due to the CKD or heart failure due to the hypertension. In that case, we are going to use the combination code. If we have a clear documentation which states that patient have the hypertension due to any other condition, or which says if patient have the hypertension due to the or the CKD due to the any other condition, in that case you have to code both the conditions separately. You are not going to use the combination code. So you can use the combination code in the absence of documentation. If the doctor does not mention anything, in that case you are going to use this. If documentation clearly states that the conditions are unrelated, in that case you have to use the two separate code. You are not allowed to use the combination code in that case. I'm going to mute myself for a moment. Just go through with the guideline number A and the guideline number 1 and let me know if you have any doubts. Done with the reading? Okay. Let's move further. We have the very beautiful flowchart here. So let's go through with the flowchart one more time. So let's say patient have the hypertension. And now coming with the heart disease. And we have to determine whether that heart disease is associated with the CKD or not. If that is associated with CKD, then we have to see what is the type of the heart failure and the stage of the CKD. If it is not related to the heart disease, then we have to tell the hypertension only. Same we have to follow in the CKD. Next, let's move further. So we have to follow the same guideline in the hypertensive chronic kidney disease. We have to use a combination code in the absence of the documentation. We have to presume the relationship. We have to use a combination code if the relationship is not mentioned. And if it is mentioned that CKD is not related to the hypertension, in that case, we are going to code it separately. We are not going to code it combination code. Next, we have hypertensive heart and chronic kidney disease. So if the patient have the hypertensive and chronic kidney disease, in this case, we are going to use a code from series I-30 followed by the I-15 and N-18 to represent the stage and the type of the heart failure and CKD respectively. If the type of the heart failure and CKD is not mentioned, or it is mentioned that the patient have the heart failure or CKD due to any other condition, in that case, we are going to use a separate code. We are not going to use the combination code. Next, we have the hypertensive cerebrovascular disease. If the patient have the hypertensive cerebrovascular disease, in that case, we are going to use the code for cerebrovascular disease at the primary position and code for the hypertension at the secondary position. So first, we have to use a code for the hypertension first, CKD, cerebrovascular disease first, and after the cerebrovascular disease, we are going to use a code from series I-15, sorry, I-10. Next, we have a code or guideline for the hypertensive retinopathy. So whenever patient have the hypertension as well as the retinopathy, what we are going to do? We are going to use a code from series H35 as well as a code from series I-10 to I-15 to represent the type of the hypertension. And the sequencing is corely based on the reason of encounter. If the patient is coming for the retinopathy, we have to code the retinopathy at the primary position. And if the patient is coming to get a treatment for the hypertension, we are going to code the hypertension at the primary position. Now, what I'm going to do, I'm going to send a one Jamil Arun answers. Okay, you can see someone is typing. So Jamil, you need to code additional code for the heart failure also, because here you cannot specify the type of the heart failure. Do one thing, go into the failure and then try to find a code for the heart. Now let's solve this question together. So as per the question, Okay, received another answer. So let's try to do it together. So the question is, patients have the hypertension followed by CKD, stage 3, and then heart failure. So what we are going to do, we are going to pull the code in the hypertension first. So we are going to refer the hypertension in the index. Here we go, hypertension. And the patient have the hypertension in the cardio, renal, heart, as well as kidney, both are affected. And then patient will have the heart failure also. So under the heart failure, we are going to use a code heart failure as well as stage 3 CKD. So our code should be I13.0. Our code should be I13.0. So if we are going to pull a code from series I13.0 in the tabular, in the I13.0, we have an instruction that we have to use additional code for the type of heart failure and the CKD. So CKD stage 3, we are going to use an 18.30. And to represent the heart failure, we are going to use I50.9. We should not use a code from series I12 because patient have all the three conditions. So if the patient have all the three conditions, we have to use a code from I13. Kashish, is it clear to you?
Yes.
And Jamil, is it clear that we have to use I50 code to represent the type of the heart failure?
Yes, ma'am.
Okay. Let's move further. Next, we have hypertensive secondary. Secondary means patient have the hypertension due to any other condition. So whenever patient have the hypertension due to any other condition, in that case, we are going to use a code from series I15. We have to use a code from series I15 whenever patient have the hypertension due to any other condition. So whenever patient have the hypertension due to any other condition, we have to use a code from series I15 as well as a code from for that condition, the other condition. Let's say patient had the hypertension due to the arteriosclerosis. So what we are going to do? We are going to code as arteriosclerosis as well as we have to code as I15 to represent that patient have the secondary hypertension. Next, we have the hypertension transient. Hypertension transient means that patient have the hypertension or the elevated blood pressure for a certain time. Say the patient have the elevated blood pressure for a certain time and does not have the diagnosis of the hypertension. Patient is not using any medication to treat the hypertension. In this case, we are going to use a code from series R03.0 to represent the patient is having the elevated blood pressure, but patient is not having the diagnosis of hypertension. So blood pressure is elevated for a certain moment, for a certain time, for a transient period, but patient does not have the diagnosis of hypertension. Next section we have hypertension controlled and the uncontrolled. So whether the hypertension is controlled or uncontrolled, our code will be the same. Our code should be from series I10 to I15. Our codes not varies based on the controlled or uncontrolled hypertension. We have the same type of hypertension, whether it's in controlled or uncontrolled, our code should be same. It should be I10 to I15. Next, we have a section for the hypertensive crisis. For hypertensive crisis, we have a code from series I16. In the I16, we have a separate codes for the hypertensive emergency, for the hypertensive crisis, and for the hypertensive urgency. You can see here, we have a different code for the emergency, urgency, and the crisis. You have to code hypertensive urgency whenever patient having the hypertension, and due to the hypertension, patient is getting any organ damage. So if the patient have the organ damage due to the hypertension, severe increase in the blood pressure, in that case you have to use I16.1. If there is a severe increase in the hypertension or the blood pressure, but there is no associated organ damage, in that case you are going to use I16.0. And if nothing is mentioned related to the organ damage, in that case you are going to use I16.9. So it just says patient have the severe increase in the hypertension or the blood pressure, but it is not mentioned whether it is having any organ dysfunction or not related to that. So in that case, you are going to use I16.9. So whenever patient have the hypertensive crisis, you have to use a code from series I16, as well as you have to use a code for the hypertension also. So hypertension as well as hypertensive crisis, you have to code both the conditions together. Next code we have other hypertension, that is resistant hypertension. You have to use a code resistant hypertension whenever patients have the hypertension and medicines are not working on that hypertension. In that case, you have to use resistant hypertension. So whenever patients have the hypertension and the medicines are not working on that hypertension, in that case, you have to use the resistant hypertension. So it should be I18.0. We do have the codes for the pulmonary hypertension. That code starts from series I27. I'm going to pull that code. So our pulmonary hypertension codes begins from the I27. Pulmonary hypertension means that patient have the hypertension which affects the pulmonary arteries and the pulmonary veins only. Patient does not have the systemic condition. Patient just have the localized hypertension. So it is an hypertension and it affects the arteries of the lungs and the right side of the heart. It will not affect the complete body. So we have two types of hypertension, primary pulmonary hypertension and then secondary pulmonary hypertension. For secondary pulmonary hypertension, it is your responsibility to use a separate code for particular underlying condition. So it is your responsibility If it is in secondary condition, you have to use a separate code to represent the underlying condition. So if it is in primary hypertension, you have to use a code only I-27. And if it is in secondary hypertension, you have to use two codes, one for the hypertension and another for the underlying condition. So I'm just going to mute myself for a moment. Just take a moment and read the guideline number 7, 8, 9, 10, 11, and 12. So I'm just go through with the guideline number 7 to 11. Just read it one by one and let me know if you have any doubts. Guys, done with the reading? Shall I scroll it down or you guys are still reading? Okay. Does anyone of you have any doubts? Shall I proceed further? I need the response from you just to make sure that you guys are aware of the guidelines. Perfect. Thanks for responding. So let's move further. Next section we have arteriosclerotic coronary artery disease and angina. So whenever patient have the ischemic pain, ischemic chest pain, so basically chest pain due to the lack of oxygen. So whenever patient have the coronary artery disease and having the ischemic pain, ischemic chest pain due to the coronary artery disease, in that case we have to use a combination code to represent that patient have the pain due to that coronary artery disease. So to utilize the combination code, we does not need to provide a diagnostic statement which says that angina is due to the CAT. If it is not mentioned, no problem. Still, you are going to use the combination code. You will use a combination code until unless doctor will clearly state that angina is due to something else and it is not related to the coronary artery disease. In that case, you are going to use the angina and coronary artery disease separately. If it is not mentioned, the relationship is not mentioned in the documentation, in that case, we are just going to use a code for the atherosclerotic coronary artery disease and angina. We have a combination code for that. As well as if the patient have the coronary artery disease as well as AMI, which is acute myocardial infarction, you are going to code the acute myocardial infarction at the primary position followed by the coronary artery disease. Because acute myocardial infarction is severe than the myocardial coronary artery disease. So this guideline simply states if the patient have the angina as well as the coronary artery disease, you are going to use the combination code until unless doctor clearly states that both the conditions are unrelated to each other. If documentation does not state anything, you have to use a combination code. If doctor states that angina is due to the coronary artery disease, in that case also you are going to use the combination code. Next we have intraoperative and the post-procedural cerebrovascular disease. So if the patient have the intraoperative and the post-procedural cerebrovascular accident, in that case, we have to use the two codes. First, we have to represent the artery affected. We have to represent the artery affected, whether it's a middle cerebral artery, right cerebral artery, the artery which is affected due to the embolism, occlusion, thrombosis. So first we have to represent the disease of the artery, the specific artery affected and the reason of the effect. As well as we have to quote another condition to represent whether it's in post-procedural or post-procedural or intra-procedural. That means during procedural. So whenever patient have the during operative or after the operative cerebrovascular accident, we have to use two codes. First, we have to code the artery affected, and the second code we have to use to represent whether it's in post-procedural or the during procedure. So we have to use two codes. So this is an important guideline. So just go through with this guideline and let me know if you want to do the question or an example. Then with the writing, did you want to do any question on this or we are good to move further? Okay, I'm moving further, okay? So next we have the sequela of cerebrovascular disease. Category I69, sequela of cerebrovascular disease. So let's say patient had the cerebrovascular disease in the past and now patient is coming with the sequela of that stroke. Let's say just patient had the stroke and now patient having the monoplegia or the hemiplegia or any type of paralysis due to that cerebrovascular disease. So in that case, we are going to use a code from series I69 to represent that this is a sequela of the cerebrovascular disease. So whenever patient have the sequela of the cerebrovascular disease, in that case, we are going to use a code from series I69 to represent that this hemiplegia, this monoplegia, and the current condition is due to the previous cerebrovascular accident. In rare instances, if the patient have the current cerebrovascular disease as well as the sequela of the previous cerebrovascular disease, in that case, we are going to use I69 as well as we are going to use I60 to I67 to represent the current cerebrovascular disease as well as the sequela of the previous cerebrovascular disease. So whenever patient have the sequela of the cerebrovascular disease, In that case, we are going to use a code from series I69. Our sequela codes, because that is a paralysis, our sequela codes are based on the dominant sides. So if the dominance is not documented, by default you will consider right side as a dominant, left side is a non-dominant, and if the patient is ambidextrous, the patient, then you have to consider it as a dominant for both the sides. So whenever I'm going to repeat it one more time. So if the documentation does not clarify whether the patient is right-handed or the left-handed, in that case, you have to code right side as a dominant, left side as a non-dominant, and if the patient is ambidextrous, you are going to code dominant for both the side, whether it's right side or the left side, you are going to code dominant. Let's move further. If the patient have the current cerebrovascular accident as well as the history of the cerebrovascular accident which leads to the sequela, then you can code both the conditions together. And if the sequela is completely treated and does not require any further treatment, patient does not have any sequelas, so in that case, you are going to code a series history code because that condition is completely resolved. Next section we have acute myocardial infarction. The acute myocardial infarction means due to the ischemic condition, the tissue has been dead. So that is acute myocardial infarction. So if the patient is coming with the acute myocardial infarction, then we have 5 types of acute myocardial. I'm going to pull that code in the index. Here we have the infarction. So under the infection, we have to go to the myocardial. Here we have the myocardial. So for type 1, we have non-ST elevation and the ST elevation myocardial infarction. So if the patient have the type 1 myocardial, for type 1 we have non-ST elevation as well as ST elevated myocardial infarction. So STEMI and non-STEMI. STEMI codes are varied based on the wall, based on the location. However, non-STEMI code, for non-STEMI we just have the one code and that code is not based on the location. So even though for non-STEMI location is given, still we are going to use I-21.4. We are not going to use the specific location code. So if it is non-STEMI, we are going to use I-21.4 only when the location is given. Non-STEMI is also known as non-transmural as well as subendocardial. Non-transmural as well as subendocardial. And STEMI is also known as transmural. So if we are able to see the transmural, that means it's in STEMI. For STEMI, we have a specific code for each location. However, for non-STEMI, non-transmural, and subendocardial, it does not have a specific code for that. Next, we have type 2, 3, 4, and 5. Type 2 to type 5 is known as secondary myocardial infarction. Type 2 to type 5 is known as secondary myocardial infarction. As this is a secondary myocardial infarction, so we have to use a separate code to represent the cause of the myocardial infarction. Secondary means that this myocardial infarction is due to some other condition. So whenever patient have the secondary myocardial infarction, in this case, you have to use two separate codes. You have to use a code for the myocardial infarction, as well as you have to use a code for the condition for the etiology that manifested the myocardial infarction. For type 1, we have I-21.3 and 4, and for type 2 to type 5, we have only I-21.A1 and I-21.A9. In the same myocardial infarction, we have the option for the subsequent myocardial infarction. We have a category for subsequent. We have to use a code from the subsequent series whenever patient have the reinfarction in the 4 weeks. So whenever patient have the reinfarction in the 4 weeks, and it should be the same type. Let's say patient have the type 1 myocardial infarction earlier, and now patient is coming for the reinfarction of the same type of myocardial in between the 4 weeks. So what you are going to use? You are going to use I series acute myocardial infarction, as well as you are going to use a code subsequent myocardial infarction. You have to code both the conditions. You have to code the acute one as well as the subsequent. You have to use a subsequent to represent the severity because patient had the reinfarction or recurrent retraction in between the 4 weeks of the previous infarction. That subsequent code is only needs to be used when doctor clearly mentioned that it is in same type of myocardial infarction. So if it is in same type of myocardial infarction, then you are going to use the subsequent. If it is in different type, let's say patient had the type 2 myocardial infarction and now patient is coming for the type 1 in between the 4 weeks. So in this case, you are going to use the acute one only. You are not going to use the subsequent because patient had the different type of myocardial infarction in 4 weeks. If it will be the same, then you are good to use the different code, the subsequent code. But if it is a different myocardial infarction, you have to use the acute only. You are not going to use the subsequent one. One more situation we have, let's say the patient is coming with the NSTEMI, and if during the hospitalization it evolves means increases to the STEMI. So in this case, what we are going to do, we are going to code the STEMI only. Code STEMI only. And let's say if we do it vice versa. Patient is coming with the non-STEMI and it evolves to the STEMI, then also we are going to code the STEMI. And if the patient is coming with the STEMI and it changes to the non-STEMI, heals to the non-STEMI, then also you are going to code the STEMI. So in each case, you have to code the STEMI because the highest one is STEMI. So if it evolves to the highest one, to STEMI, you have to code the STEMI. If it reduces to the non-STEMI, then also you have to code the STEMI only. Now I'm going to mute myself. Just go through with the guideline number 1, go through word to word, and let me know if you have any doubts, any questions, or anything you want me to repeat. Go through with the guideline number first, then I'm going to repeat that one. Just go through with this guideline. Once everyone is done, then I'm going to repeat that third point. Done with the reading. Shall I move further? Guys, any question in the first point? Okay. Now I'm going to move further. So, Kashish, that third point states if the patient had the history of cerebrovascular accident and in current we does not have any symptoms or any sequela, so in this case you are not going to use a code from series I-69, you have to code the history. So whenever a condition is completely resolved and does not have any further symptoms or the sequela, so in that case we have to code the history of that condition. So third point completely states if the condition I-69 you have to use only if the patient has any symptoms. If patient does not have any neurological deficits, in that case you are not going to use a code from series I-69. In that case you have to use a history code because that condition is completely resolved. Kashish, clear to you?
Yes, ma'am. Thank you.
Perfect. Let's move further. Next we have acute myocardial infarction. So we have already gone through. If the type of myocardial infarction is not mentioned, it should be I-21.9. For STEMI, it should be I-21.3. For non-STEMI, it should be I-21.4. If we have a non-transmural or subendocardial myocardial infarction, in that case, it should be I-21.4, even though we have the documentation of location. Still, we are going to use I-21.4. Next item we have subsequent acute myocardial infarction. We have to use a subsequent code whenever patient have the same type of myocardial infarction within the 4-week time frame of the initial AMI. You have to make sure that it should be the same type. You should not assign the subsequent code if the patient had the type 1 myocardial infarction and the patient had the type 2 AMI earlier. So in this case, we are not going to use the subsequent because it's a different type of myocardial infarction. If the subsequent myocardial infarction of one type occurs in the 4 weeks, reoccurs within the 4 weeks, then only you have to use a code from series I-21 and I-22. In that case, we are going to use a code for the current myocardial. We are not going to use the subsequent myocardial infarction. Next, we have other type of myocardial infarction. So type 2 to type 5 myocardial infarction is known as the secondary myocardial infarction or other type of myocardial infarction. So for other type of myocardial infarction, what we have to do? We have to use a code from series I-21.A1 for the type 2, and you have to code the underlying cause also to represent the reason of the myocardial infarction because it's in type 2. So any myocardial infarction from type 2 to type 5 is known as a secondary myocardial infarction. So in this case, we have to use two separate codes here to represent the underlying reason as well as the type of a myocardial infarction. So whether it's in type 2 or type 3 to type 5, we have to use two codes and the sequencing instructions are mentioned in the tabular. The last guideline of this chapter we have myocardial infarction with the coronary microvascular dysfunction. So coronary microvascular dysfunction is a condition where patient have the issues in the microvasculature, that is capillaries or the arteries. In that case, we are going to use the I-21.B whenever patient have the infarction as well as the issues in the microvascular dysfunctions. In this case, we have a specific code that should be I-21.B. So I-21.B is specifically designed to use whenever patient have the coronary artery disease or myocardial infarction as well as the coronary microvascular dysfunction. In that case, we have to use I-21.B. Just go through with the guideline number 6 and let me know if you have any doubts. Done with the reading? Any questions, any doubts? Okay. So we have completed the chapter number 9 also. So from next session, we are going to start the chapter number 10. And in next few minutes, I'm going to send few question papers with you. Just go through with that assignments and throughout the week. And in the next session, first we will go through with your question, then we will start our next chapter. So thanks everyone. Thanks for joining. Bye bye.